Is gum disease contagious? Gum disease itself is not directly contagious in the same way that a cold or flu can be transmitted through airborne particles or physical contact. However, the bacteria that contribute to gum disease can be transferred from one person to another through activities that involve close contact and the sharing of oral bacteria. Here are some ways in which the bacteria associated with gum disease can potentially be transmitted. 1. Saliva transfer, sharing eating utensils, drinking from the same glass, or kissing can introduce oral bacteria from one person's mouth to another. Bacteria from an individual with active gum disease could potentially be transferred this way. 2. Parent-child transmission, babies and young children can acquire oral bacteria from their caregivers through activities such as sharing utensils, pacifiers, or oral contact. 3. Intimate contact, engaging in intimate activities that involve close oral contact could potentially facilitate the transfer of oral bacteria, including those associated with gum disease. 4. Dental procedures, in rare cases, improper infection control practices in dental settings could potentially contribute to the spread of bacteria between patients. It's important to note that while these modes of potential bacterial transmission exist, the risk of directly acquiring gum disease from another person is relatively low. The development of gum disease involves a combination of factors, including genetics, oral hygiene practices, overall health, and individual immune responses. However, maintaining good oral hygiene practices, such as regular brushing, flossing, and routine dental checkups, can help minimize the risk of developing gum disease and reduce the potential for bacterial transmission. If you're concerned about your own gum health or potential exposure to oral bacteria, it's a good idea to focus on maintaining your oral hygiene and seeking appropriate dental care. Is gum disease hereditary? Yes, there is evidence to suggest that genetics can play a role in an individual's susceptibility to gum disease, periodontal disease. While gum disease is primarily caused by factors such as poor oral hygiene and bacterial plaque, genetic factors can influence how an individual's immune system responds to the bacteria and inflammation in the oral environment. Here's how genetics can contribute to gum disease susceptibility. 1. Immune response. Some people may have genetic variations that affect their immune response to bacterial infections, including those in the mouth. A less effective immune response might make it more challenging for the body to control the inflammation and infection associated with gum disease. 2. Inflammatory markers. Certain genetic factors can influence the levels of inflammatory markers in the body. Elevated levels of inflammation can contribute to the progression of gum disease. 3. Collagen structure. Genetic variations can impact the structure of collagen, a key component of the gums and other connective tissues. Altered collagen structure might affect the stability and health of the gum tissue. 4. Enzyme production. Genetic factors can influence the production of enzymes that play a role in breaking down and regulating the extracellular matrix of gum tissue. Imbalances in these enzymes can contribute to tissue damage. Can gum disease cause jaw pain? Yes, gum disease, periodontal disease, can potentially cause jaw pain, particularly in more advanced stages of the condition. The jaw pain may be due to several factors related to the progression of gum disease and its impact on the supporting structures of the teeth. Here's how gum disease can contribute to jaw pain. 1. Inflammation and infection. Gum disease involves inflammation and infection of the gum tissues, which can extend to the periodontal ligaments that anchor the teeth to the jawbone. This inflammation and infection can cause discomfort and pain in the jaw area. 2. Tooth mobility. As gum disease progresses, it can lead to the loss of bone that supports the teeth. This can result in increased tooth mobility and shifting of the teeth within their sockets. The movement of teeth and their impact on the surrounding structures can lead to jaw pain. 3. Abscess formation. In some cases of advanced gum disease, abscesses, pus-filled pockets, can form around the teeth or in the gum tissues. These abscesses can cause localized pain and discomfort in the jaw area. 4. Bruxism. Teeth grinding. Gum disease and bruxism often coexist. Bruxism involves the grinding or clenching of teeth, especially during sleep. bruxism can exacerbate the effects of gum disease and contribute to jaw pain and muscle soreness. 5. Temporomandibular joint, TMJ, issues. While gum disease itself primarily affects the gums and supporting structures of the teeth, chronic inflammation and pain in the oral region can potentially impact the function of the temporomandibular joint, leading to jaw pain. It's important to note that jaw pain can have various causes, and gum disease is just one possible factor. Other conditions, such as temporomandibular joint disorders, DMD, sinus infections, dental abscesses, and dental decay, can also lead to jaw pain. If you are experiencing jaw pain or discomfort, it's recommended to consult a dentist or healthcare provider for a thorough evaluation. They can help determine the underlying cause of the pain and recommend appropriate treatment to alleviate your symptoms and promote oral health. What kind of chewing gum cleans your teeth? Chewing gum that is recognized by dental professionals as sugar-free or xylitol-sweetened can have some benefits for oral health. While chewing gum is not a substitute for regular brushing and flossing, it can help stimulate saliva production and promote a cleaner mouth after meals or when brushing is not immediately possible. Saliva plays a crucial role in neutralizing acids, washing away food particles, and remineralizing tooth enamel. Here are some types of chewing gum that may contribute to oral health. 1. Sugar-free gum. Chewing gum that is sugar-free does not contribute to tooth decay like sugary gum does. It's a better choice for maintaining oral health. 2. Xylitol-sweetened gum. Xylitol is a sugar alcohol that has been shown to have potential benefits for oral health. It can help reduce the growth of bacteria in the mouth and inhibit the formation of plaque and tooth decay. Xylitol-sweetened gum can be a good option for promoting oral hygiene. 3. ADA Seal of Acceptance. Look for chewing gums that have earned the American Dental Association (ADA) Seal of Acceptance. This seal indicates that the product has met specific criteria for safety and effectiveness in promoting oral health. 14. Gums with added minerals. Some chewing gums contain added minerals like calcium and phosphate, which can help remineralize tooth enamel. When selecting chewing gum for oral health benefits, remember the following. Choose gum that is sugar-free or xylitol-sweetened to avoid contributing to tooth decay. Chewing gum should not replace regular brushing and flossing. Chewing gum should not be used as a substitute for professional dental care and regular dental checkups. Is gum disease linked to other health problems? Yes, there is a growing body of research that suggests a strong link between gum disease, periodontal disease, and several other health problems throughout the body. The connection between oral health and overall health is often referred to as the oral systemic link or oral systemic connection. While the exact mechanisms are still being studied, it is believed that chronic inflammation and the presence of oral bacteria can contribute to various systemic health conditions. Some of the health problems that have been linked to gum disease include 1. Cardiovascular disease. Research suggests that the inflammation and bacteria associated with gum disease may contribute to the development of heart disease, stroke, and atherosclerosis, narrowing of the arteries. Inflammation in the mouth may also impact blood vessel function. 2. Diabetes. People with diabetes are at a higher risk of gum disease, and gum disease can make it more difficult to control blood sugar levels. Conversely, uncontrolled diabetes can impair the body's ability to fight infection, including gum infections. 3. Respiratory infections. Bacteria from the mouth can potentially be inhaled into the lungs, increasing the risk of respiratory infections and exacerbating conditions such as pneumonia. 4. Rheumatoid arthritis. Some studies suggest a link between gum disease and rheumatoid arthritis, as both conditions involve chronic inflammation. It's believed that the inflammation in the mouth may contribute to the development or exacerbation of arthritis symptoms. 5. Pregnancy complications. Pregnant individuals with gum disease may be at a higher risk of preterm birth and low birth weight. The inflammation and infection associated with gum disease could potentially impact fetal development. 6. Dementia. Some research indicates a possible association between gum disease and cognitive decline, although more studies are needed to fully understand the relationship. 7. Kidney disease. Chronic kidney disease and gum disease share some common risk factors, such as diabetes and hypertension. Additionally, inflammation and infection in the body could potentially impact kidney function. It's important to note that while these links have been identified, the exact cause and effect relationships are complex and often involve multiple factors. Maintaining good oral hygiene, seeking regular dental care, and addressing gum disease promptly can potentially have positive effects on overall health. Conversely, managing systemic health conditions and adopting a healthy lifestyle can also contribute to improved oral health. Can gum disease lead to tinnitus, ear problems and deafness? While there is ongoing research and exploration of potential links between gum disease and other health conditions, the direct connection between gum disease and tinnitus, ear problems, and deafness is not well established. However, there are some theories about how oral health might impact overall health, including the auditory system. Tinnitus, ear problems, and deafness are complex conditions with various causes, and multiple factors can contribute to their development. Here are a few considerations related to these conditions. 1. Inflammation and systemic health. Chronic inflammation, which is a hallmark of gum disease, has been linked to various health problems throughout the body. While there isn't strong evidence directly linking gum disease to tinnitus or hearing loss, it's possible that systemic inflammation could play a role in certain cases. 2. Blood vessel health. Both gum disease and some forms of hearing loss can be influenced by blood vessel health. Damage to blood vessels can impact circulation and oxygen supply to various tissues, including those in the auditory system. 3. Immune system response. The immune response involved in gum disease could potentially affect other parts of the body, including the auditory system. However, the specific mechanisms and connections are not yet well understood. 4. Shared risk factors. Some risk factors for gum disease, such as smoking and diabetes, are also associated with certain types of hearing loss. Addressing these risk factors could have a positive impact on both oral health and auditory health. 5. Overall health and well-being. Maintaining good overall health, which includes oral health, is important for overall well-being. While there might not be a direct cause and effect relationship between gum disease and tinnitus/ear problems, practicing good oral hygiene and seeking regular dental care are important for maintaining overall health. It's important to emphasize that while there is ongoing research in this area, more studies are needed to fully understand any potential links between gum disease and conditions like tinnitus, ear problems, and deafness. If you have concerns about your oral health or any related symptoms, it's recommended to consult both a dentist and a medical professional to receive comprehensive care and appropriate guidance.